Let's take a first look, though, at what happened to nursing since the pandemic. Nursing is the nation's largest healthcare profession with nearly 4.2 million registered nurses, RNs nationwide, and of all the licensed RNs, 84.1% are employed in nursing. The federal government projects that more than 203,000 new registered nurse positions will be created each year from 2021 to 2031, with more than 3 times as many RNs in the United States as physicians.
Michelle Brownlee vividly remembers the chaotic pandemic surges, changing in and out of hot, uncomfortable COVID gear, dealing with double the patient load and limited support staff. For her and thousands of other frontline COVID nurses, the pandemic was physically and mentally devastating. Melinda Lakatos was nurse manager on one of 3 COVID floors at Parma Medical Center.
We normally would see about 1 to 2 deaths a year on our floor as normal aging process and end of life. With COVID, within the last 2 years, we've seen more than 150 on this floor alone.
Visitors barred from seeing loved ones, so nurses became their only link.
And things that they teach you, they tell you in nursing school, oh, you can't get personal, you can't exchange this. But again, they don't teach you how to navigate a pandemic. And when you're the only source of comfort and the only link between a family and a loved one at home, you have to.
It was a lot of emotional stress on the staff. I have been there for the staff. We supported them with providing them emotional support through our employee assistance program through UH.
Which has been pivotal in us recovering from what we've dealt with.
The nursing shortage began long before the pandemic. COVID made the shortage grow larger as 1 in 5 healthcare workers left their careers, and reasons are many. One study found between 17 and 30% of new nurses leave within the first year of work, and up to 56% leave within the second year. Surveys showed nurses cite burnout and high-stress work environments as main reasons for leaving, followed by compensation, benefits, and the rise in violence against healthcare workers. Also, many nurses are near retirement age. Michelle thought about leaving, but didn't, thanks in part to supervisors like Melinda.
This is my 30th year in nursing, and this is my career. And as a manager for 15 years, I think that the staff that I have on this floor is exceptional. Just remembering that, whatever came at them, they took, and they're working for the care and compassion of the patient.